A very good day I bid to one and all. Our group today will present about infectious disease, which is dengue. Our group member consists of Kahirul, Balqis, Ilyana, Farah and Azmar. We are all from Preparatory Center for Science and Technology, University Malaysia, Sabah.
Infections defined as the attacks of the body tissue of a host organism by the disease-causing organism, its reproduction, and the response of the host tissue to this organism and the toxin release. Infectious disease, also known as transmissible disease caused by bacteria, virus, fungi, and parasite in our environment. Aedes aegypti mosquito is a vector of arbovirus disease that is very dangerous that can cause patients to die in just a few days. Dengue fever has been a global problem since World War II and frequently occurs in more than 120 countries, particularly in Southeast Asia, South Asia, and South America. About 319 million people are infected a year and about 40,000 die. Severe dengue fever can cause serious illness and death. So for objective, we apply how dengue attack immune system, and second, to find the way to prevent the disease.
Each year, the number of dengue patients increases rapidly, and this situation worries a lot of parties, especially the community. Dengue virus was a dangerous pathogen that can lead to death if the patient was late to get the treatment. As an employer of health company, we are given the task to give a presentation to the danger of outbreak in healthcare company and explain how the disease is transmitted. Also, we will explain about the way of prevention from dengue virus.
Is dengue 1 until dengue 4. Dengue is one of the world's more rapidly spreading mosquito viral disease. Based on the statistics, up to 3.6 billion people are estimated to now live in tropical and subtropical areas where the dengue viruses have the potential to be transmitted. Globally, it is estimated that approximately 50 million to 200 million dengue infections and up to 500,000 cases of severe dengue and over 20,000 dengue-related deaths occur annually. So an Aedes takes around 7 to 10 days for an egg to develop becoming the adult mosquitoes. There is 4 stages to the mosquitoes, which is egg, larva, pupae, and lastly is adult mosquitoes.
Mild symptoms usually begin with a sudden and large rise in temperature. This followed by other symptoms such as high fever, headache, nausea, vomiting, rash, itches, abdominal cramp, loss of appetite, pain behind the eyes, swollen gland and muscle, bone or joint pain. However, mild symptoms of dengue can worsen to a severe one within a few hours. Severe dengue occurs when the blood vessels are damaged and leaky, causing the number of clot-forming cells or platelets in the bloodstream to drop. Thus, it leads to shock because of the abdominal pain, significant fall in blood pressure, internal bleeding, organ failure, and fatal. Significant blood pressure will result in clamminess, weak pulse, dizziness, and even loss of consciousness. People with severe dengue fever will develop warning signs quickly. The warning signs are very threatening and usually begin either the first or second day after the fever goes away. Warning signs include severe stomach pain, persistent vomiting, bleeding gums or nose, irritability, fatigue, restlessness, difficult or rapid breathing, bleeding under the skin, and blood in the urine, stool, or vomit.
Okay, the virus that causes dengue disease is divided into 4 closely related serotypes, which is dengue virus 1, 2, 3, and 4, and those serotypes can be further divided into genetic variants or subtypes. The researchers showed that a person's prior immune response to one serotype of dengue virus could influence the interaction with virus subtypes in a subsequent infection. Next, it was already known that upon a person's first infection with dengue virus, the immune system reacts normally by creating antibodies to fight the viral invaders. The problem is that those antibodies can be then confused if confronted later with one of the other 3 types of dengue virus, and as this new study revealed even different subtypes within the same serotype. Next, with the second infection, the antibodies sort of recognize the new type of viruses but not well enough to clear from the system. Instead of neutralizing the viruses, the antibodies bind to them in a way that actually helps them infect the immune system's other cells and spread. On the first infection, most people have relatively minor symptoms, which is fever and muscle and joint pain. For many people, a second infection is similar to the first, but for a third group, a second infection can cause what has come to be known as dengue hemorrhagic fever or dengue shock, which is known as DHF or DSS. However, this form is much worse for the patient, as symptoms include loss of bodily fluid due to blood leaking from vessels, which in turn can lead to organ failure and possibly death. Bleeding under the skin, frequent vomiting, abdominal pain. The more severe symptoms of dengue hemorrhagic fever often develop after they start to recover from the dengue virus. Health scientists have had difficulty agreeing on the cause of DHF or DSS, though some suggested it relates to the level of antibodies produced and maintained after the initial infection. As a figure 4, which is dengue fever diagnosis flow charts. So it is a chronology how to identify if someone have dengue virus infection. Next, for figure 5, it is phases of infection resulting in dengue hemorrhagic fever. There are 3 types or 3 phases, which is febrile, critical, and reabsorption. So from this figure, we know that for phase of febrile, fever lasts for 2 to 7 days, and for plasmalic, it lasts for 24 to 48 hours, and for reabsorption, it lasts for 2 to 4 days.
The dengue virus was born to the cell surface before infecting it. It entered the cell by being encased by the cell membrane during the formation of a pouch-like structure known as endosome. To initiate the infection process, the virus injects its genetic material into the cytosol, the cell fluid interior. When it starts to reproducing itself, however, it must first free itself from the endosome. This is accomplished by fusing the membrane of virus with the endosomal membrane. When these two membranes come together, they form a pore that allows the virus release its genetic material. Once within the cell fluid nucleus, the virus starts to replicate itself.
Dengue virus actually originated in monkey and slipped over into humans years ago. And the dengue virus spread throughout Southeast Asia via maritime shipment. Based on figure, shows the dengue transmission cycles. Dengue fever cannot be infected from human to human. However, there is only one cause of spreading dengue, which is through the mosquito bite. This started when a mosquito bites a person who is infected with dengue virus that caused the mosquito to be infected. Infected mosquito then bites another person who is healthy, and hence it caused the virus to enter the person's bloodstream and cause an infection. This cycle will then continue. There is no treatment or specific medication for dengue fever. Those who are infected with dengue are advised to seek medical advice from a doctor. They are advised to rest well and stay hydrated by drinking plenty of water. But alcohol and beverages should be avoided. Medicine like paracetamol can be taken to recover fever and reduce joint pain, but be careful not to take medicine that will increase the risk of bleeding, such as aspirin and ibuprofen. Hospitalization is needed for patients who develop severe dengue that can lead to dengue shock hemorrhagic and dengue hemorrhagic fever. Platelet transfusion will be proceeded to cure a lower blood platelet that cause bleeding symptoms. This is important to reduce the probability to fatality. Hence, there is no valid or approved vaccine until now.
Firstly, for our family and around the house, we need to make sure that we clean up all the possible places that mosquito can breed. Like an example, excess water from plant pot plates inside the unused vases, and many more, because mosquito can breed in a small amount of stagnant water. For ourselves, we need to wear the covered clothes when we are going to the high potential places like a camping site. It can help to reduce the amount of skin exposed so that mosquito will find it hard to bite us. One of the ways to make people aware of this disease is make a program school-based health education for dengue control, especially to the primary school students. This is because children can build great knowledge from a young age. They are constantly absorbing new information quickly. It helps them to become aware of the virus. Next, we should schedule a fogging operation, especially at the places where the case is increasing. It can help to kill the adult mosquito that may be carrying the Aedes, dengue virus, hence make people who are living around become more aware to the disease.
So, in conclusion, although cases of dengue fever outbreak have adversely affected the city of Phuket in Thailand, good Good judgment should be adhered to by one and all. This means that everyone must adhere to safety measures or precautions to overcome the constant barking with the assurance of all have a better tomorrow can be achieved in the future.